Okay, so we've got a video that talks about the fact that shoulder problems can be coming from all sorts of places that are a long way from the shoulder. Okay, so that's a separate video which you should already be able to see. It could be coming from the wrist, etc. But one of the fundamental things about the shoulder, as opposed to any other joint in the body, is it has a massive, under normal use, a massive range of movement. So if I take my arm, I can bring it back, and I can bring it up, and I can bring it round. I can't do that with my leg. And I would challenge most people to be able to quite do the same range of movement as the shoulder. So what happens is the brain worries, because we're using the body in the wrong way. We've already talked about that. We've already talked about the fact that biomechanically the force from the leg and from the arm are supposed to be up into these plates. They're not supposed to be hanging down. But at the slightest provocation, the body will lock the shoulders down. And it will just do it sometimes for people. They may wake up one morning and suddenly they find that they've got restricted movement. And that's probably more likely to be an injury as an acute injury. You know, some people have to have their shoulders rebuilt after they've motorbike scrambled, and that kind of injury is quite common. But for a lot of people, it can often be for reasons they can't even really place. Their shoulder gradually starts to cause them problems. And they're waking in the night, and it's painful if they're lying on the shoulder. It's painful if they're lying with the painful shoulder upwards, because even just it hanging down is painful. And over time, because the brain is so worried about the shoulder, because it knows that it can dislocate so easily, because it is the most unstable joint in the body with the most different tensional forces on it, pulling it this way and that way, it starts to lock it down. So you get into a cycle of, I move my shoulder, it hurts, I don't move it that far again. I move it again, it hurts, I don't move it again. And eventually people can end up with the shoulder down this low, so that they can virtually not get a bar of soap under there. So it does depend with shoulder injuries, but whatever is happening when we're trying to help somebody like that, we have to remember, above all, that we've got this brain factor in there. Okay, and having had 2 frozen shoulders that went on for years and years, I'm speaking from experience. So what we have to do is we have to teach the brain that it's safe to move. We have to give it jobs to do. Now that can be things like slowly rotating round, no pain being the golden rule, or it might be starting to allocate it some very gentle jobs in the house, whereas it might be your non-dominant arm. We do the same with clients who've had strokes and sepsis and things like that, where they're having to rehab and relearn things. We might be saying, take the mugs out of the cupboard with your non-dominant arm, say, if that's the one that's injured. But all the time we will say to people, look, just, even if you only do 1 circle of your arm, slowly, that is better than doing 10 of these where you could be doing all sorts of untold damage. What you're trying to do is just override the body's real fear of this dislocating. So the work that we do, which we've talked about in the other video in terms of looking for, you know, what muscles and what soft tissues, what fascia, whatever is tethering things in certain places. But above all, we're trying to override the brain going, look, you know you've kept locking this down, it's safe to move it. It's safe to move it, and look, that bit didn't hurt. Give the brain another day or 2, it might decide to give you a little bit more movement. So shoulders have got, I mean, shouldering a burden is a known kind of phrase, but actually with shoulders there often is a kind of an emotional and a mental element with it. And I'm not talking about some woo-woo-y something that's you know, imprecise. I'm saying that sometimes with injuries, sometimes we're having to counteract and make sure the client understands that going to the gym to strengthen a shoulder is of the reverse of what we might do with the bone therapy. We're trying to help the brain to switch off the tension patterns, to allow normal movement to be restored, to build up that communication between the brain and the shoulder and the arm that doesn't tell it to ever put the brakes on. It's almost like driving in ice with a car. Keep it in low gear, go very, very slowly, no sudden moves. Okay, it's exactly like that really. Thinking about it, that's quite a good analogy. So when we're talking about shoulders, the overriding thing is don't be harsh to your shoulder, don't wrench your shoulder, don't this, don't that. Obviously, in due course, if somebody's needing to be strengthened again in the shoulder for particular things, say they're a gymnast or they are, you know, doing other things that require a great deal of upper body strength, then you might need to go to, you know, a physio or a specialist in that area for strengthening exercises. But we're there initially to try and help switch off a lot of the tension patterns that are formed and to help with the brain-shoulder communication that it's becoming safe to reuse it again and integrate it back into life.